morning, Ayan.
Honorable members, good
morning.
Good morning, Chairperson.
Are you alive today?
Good morning.
We are trying to do as possible while surviving. Ayanda, can I check how many of our members are here?
Okay, Chair, I'll check. Chair, I've got 4 members so far. Mr. Mahlaule, Miss Phillips, Miss yourself. Yeah, it's 3, Chair. Can I take? I see Mr. Mtenjan is trying to call me. Maybe he's trying to get in.
Mr. Milam is also in, Chair. There's 5 members, including you, Chair.
You are short with 1 then. No, we are 6. Because is Mr. Kula in?
Yes, I'm also in, Chair. I'm trying to settle down.
I see Moses or M now. I didn't know. That's why I'm asking. Anyway, are 6 because this Valencia is also has just joined in. Can we continue?
Yes, Chair, we can start.
We are 6.
Yes, Chair, Mr. Mtenjana is trying to connect. I'm assisting him on this side. He's got a network problem.
There is
but
me
we can continue.
here.
We can start.
That's what it says. There is me. There is Malinga, the Honorable Malinga, the Honorable Phillips. There is Honorable Mailam. There's Honorable Mahlaule. There's I don't know why he's written in bold. Maybe he's a super guest than us. There's Honorable. It says Moses or MA, and I suspect that's why I was asking Honorable Code. So we are 6. Good morning, honorable members, and our invited dear guest in this occasion of today. We hope we will have a very fruitful and productive meeting. What we are actually dealing with today, it's going to be only one item where we tried our level best to ensure that it will have the participation of almost all the stakeholders with regards to the issue of the pandemic, which is the coronavirus. Having said so, can I take the apologies, Ms. Boss and Mr. Kotze?
Okay, Chair. Good morning, members and our guest. I've got apology from Ms. Ntokoze Hlonyane. She's still not well. She will join us next week. That's one apology I have at the moment, Chair.
Okay. Being the case as it may, we have invited the representatives from Mincosa, but also we had invited the organized labor. I must say that we did receive a letter from the organized business in the form of Mincosa in mining, requesting that to be able to share or brief the committee, but also because of the challenges with the operations with regards to virtual meetings, and the fact that we might be going, or we are going on recess within 7 days now, we then felt that we needed also to get the views of organized labor in the mining sector. Because if we were to wait until recess, then it would have meant that they would get an opportunity almost a month later or so, or even more than that, depending also on the compulsory schedule of Parliament of some of its activities, including for the committees. So you will bear with us because we know that you may not have enough time, but we think it's important and critical just to listen and get the thoughts. I know that had we invited only organized business or the employers, there could have been a lot of misunderstandings. Hence, we said, in as much as we give that latitude, we must also have an ear for organized business to provide a response. Unfortunately, organized employer in the sector, in this case, Mincosa, is one which has written, and we have got more than one representatives of workers in the sector, which is why then we have to split time to ensure that sectorally, it's one sector that is presenting. So you will bear with us. Our meetings can only go as far as 12 o'clock. And that includes your presentations and your what you call it, and the questions and clarities from members. So you'll bear with us that we gave especially so much time. It is not because we wanted to have a shorter time or shorter version. We can't go beyond 3 hours. It's a strictly time given to us. Having said so, I saw that the CEO, if he is still the CEO of Mincosa, that Roger is here, and quite a number of his delegation. Please bear with me. I've not seen the president of Mincosa. Can I give it to you, Mr. Rogers, and welcome you. Please take us up until 9:40. Thank you very much.
Honourable Chairperson, thank you very much. And
Sorry, Chair. Sorry, Chair.
Yeah, hello?
Hello?
Yes.
Is Xolani Bogoloshe, Chair. Sorry, the network is poor. I don't hear you what you have said. I'm not sure it's only me, but your voice is not clear. Thank you.
It might be a problem your side.
Yeah,
Do you
same,
get me on
same
the-
here, Chair.
Where?
I also do not hear, Chair.
so, Chairperson, we've heard you clearly, but maybe some members are having.
Okay, let's make it simple. I'm saying the Mineral Council will take us up until 20 to 10, and thereafter we will go to organized labor. I'm saying the time that is allocated for virtual meetings of Parliament is 3 hours. We can't go beyond 3 hours. We will try to allocate as much time sectorally, because there are more than one union in the for organized labor. So that's the point we're saying. Can we then get the Minerals Council to continue?
Honourable Chairperson, certainly happy to go ahead.
Sorry, Chair. Sorry, Chair. It's Lisa here from LAC. I also cannot be able to hear you, and I'm wondering if there is no way that you can make sure that we can hear your voice, because I think there's a network problem, but also if you can be able to either increase the speaker's voice such that we are able to hear from our end.
Sorry, Chair.
Can we allow the technicians to help, because I can't even hear you as you speak yourself. I only hear you cutting off. But the majority of the members that are here and the guests who have invited, they seem not to have that problem. Can you allow the secretaries to help those who have got a technical challenge on the issue of the network? Can you, Minerals Council, continue, please?
Sorry, Chair, before we can start, can I request all those guests that are not speaking at the moment to switch off their cameras? Only the person that is doing the presentation, and when the members are asking questions, to please switch on their cameras.
Okay, but can you attend to the technical challenge, please?
Yes, Chair, we are attending to it, but I think the problem is on their side, because I can hear you clearly, and I just heard Roger on the other side. The network on my side is fine, but I'll speak to IT.
Please, can you attend on the matter, please? Can you continue, Minerals Council?
Honourable Chairperson, thank you very much. To honourable committee members, very good morning to all of you. I trust that you're all keeping safe and well. The Minerals Council this morning has a small team. We're going to be very brief and direct in our input. We've got Dr. Tutula Balfour, who is Head of Health, joining me. We've got Mr. Aubrey Ramawa, who's our senior person down in Cape Town in Parliament. We've got Mr. Nix Lesufi, Senior Executive. We've got Mr. Motsamai Matlami, who's our Head of Employment Relations. And we've also got Mr. Tabelo Chapana, who is our Senior Executive, also in the Minerals Council. So, Ayanda, are you going to be controlling the presentation from your side, or can I put it up from my side?
Roger, we asked Aubrey to put on your side. He said he can do it.
Okay, I'm going to put the presentation up right now, if that's okay.
Thank you.
And hopefully you should be able to see that presentation. So is everyone able to see it?
Yes.
Yeah.
Okay. Right, thanks very much.
I don't see on my side, I don't see the presentation.
Okay. I think it's probably a delayed feedback into other people, but just if I think we need to obviously progress as quickly as we can with the presentation. Ayanda, you can see it. Chairperson Luzipo, you can see it?
I think you can continue, Roger, because it's on the screen. Those that cannot see, we can continue in the meantime and sort the matter because the time is running now.
Exactly.
Continue, Raj.
So, Honourable Chairperson and Honourable Members, our approach from the Minerals Council side to this pandemic has been a risk-based approach. It's been an approach of putting in place as all the preventative and mitigating controls wherever possible to manage the pandemic and obviously to help get the industry back to work. I think the adage that everyone has been looking at has been this concept of saving lives and saving livelihoods, and getting the industry back to work is about saving the livelihoods, but doing it in a preventative, controlled manner, using all the right standard operating procedures, et cetera, is very much part of saving lives. The Minerals Council has had extensive engagement with the Department of Mineral Resources and Energy, with the Chief Inspector of Mines, who is on the line, and his team. Lots of work and engagement with the unions. A lot of that discussion has taken place at company by company level, and we've tried to work and manage this entire process in a way which really helps us to prevent the spread of infections, but obviously to make sure that when we do the proper screening and testing, we are able to really help to manage the pandemic as much as possible. And I think those protocols and systems are really working. They're working very well, but we're going to give you a quick highlight of some of the actions that we've taken so far. So what I'm going to do is, I've talked a little bit about our approach. Dr. Balfour is going to give you some input on the health response, on our screening and testing statistics that are coming through at the moment. Motsumai Motlame is going to give some employment relations related issues, because clearly there's been some stress that the industry's been under, but he's also been helping to manage that process. Mr. Jabana is going to give input on what we've been doing within mining communities. I'm going to give a little bit of a quick economic snapshot of where the industry is at the moment. And by that stage, we should have finished the presentation and would obviously wait for the direction of the chair. We have an extensive website, Minerals Council website. And so what I'm going to quickly do is just give a little bit of a schematic of what we're doing. We've very much seen this as a shared responsibility, working for the effective implementation of the measures to ensure healthy and safe working practices, which obviously clearly rest with management, but also with employees, their elected representatives, and clearly the regulator. And I think there's been a lot of work. I think we mustn't underestimate the amount of engagement that has taken place, whether it's through the Mine Health and Safety Council, whether it's through bilateral meetings between the different stakeholders, whether it's at mine level. But obviously it goes beyond the workplace. Clearly, workers spend a part of their time in the employment in the workplace itself. They go back to their families in communities, and clearly this is one of the areas where a critical role that all of us have to make sure that we limit the spread of this virus at home as well as in the workplace. I'm going to hand over to Dr. Balfour, who's going to give us some of the health interventions. But what I'd just very quickly like to say is, if we think about this is a black swan event. It's kind of like once in maybe a couple of generations event, which hits us. Unprecedented socio-economic disruption. Certainly from the Minerals Council perspective, we were supportive of the early phase of the lockdown as a way of trying to enable the healthcare services to prepare adequately, and also to enable us to get prepared to manage the process as best we can in circumstances. If I just go to the next slide. Effectively, what we've done is, and this just simply highlights that even as early as February, the Minerals Council had already been communicating with our members on both the NICD protocols as well as on the World Health Organization protocols of how you manage a virus of this particular nature and status. So obviously on the 11th of March, the World Health Organization declared COVID-19 as a pandemic. We provided a lot more further information to our membership. We provided a lot of posters, a lot of preparatory work that the companies could start doing to prepare themselves to manage the pandemic, and obviously lots of engagement with other stakeholders. So let me hand across to Dr. Balfour, and I'll control the presentation from this side, and I'm going to hand over to her. And she's been leading our health effort and has played a key role in the industry's efforts in managing this pandemic. So Chairperson, Dr. Balfour is now going to take over, and I'll do the steering of the presentation. Tutula, across to you.
Thank you, Roger. Thank you, Chairperson, and good morning, Honorable members of Parliament and everyone on the meeting. As Roger has said, you know, this is very unprecedented and it has caused a lot of disruption. Most of us are actually not doing the work. You know, we all came with work plans for this year and all of those have been shelved and we're all running around regarding COVID. So it is quite a very disruptive incident. Taking off from where Roger left off regarding our response, as has been said, we, as the Minerals Council in February, we started with the communication well before South Africa had its first case on the 5th of March. And we then, on the 17th of March, put out our 10-point plan to our members. It was a preparedness plan, which covered a lot of the things around prevention of the disease and making sure that the companies had the necessary consumables and the stock. For instance, PPE, a lot of people have been running around looking for PPE. In our mining sector, PPE has been there, mainly because we alerted our members that there is this epidemic, it's coming, ensure that your PPE is in place, your flu vaccines are in place. Unfortunately, there was a shortage of the flu vaccine and it was only available in limited stocks. About 2 million doses were made available to South Africa and most of these were used by the public sector. So I'm just making that as an example of the things we said members need to put in place, especially the education. We said concentrate on the education to make sure that your employees are aware of what is coming, so that once the disease hits, all your systems are in place. We then produced in March, 25th of March, a standard operating procedure on the management of COVID-19, and this was followed in April after the lockdown. If you remember, and towards the end of March, there was the lockdown, and we then had to produce a standard operating procedure for our members to say when people are coming back from the lockdown, what are the key things that you should be doing? This was before the DMRE had produced its guideline, and I may add that that is part of what guides us now, you know, on our response. So things, for instance, such as employees from epicenters. Epicenters are defined as those with more than 5 people with COVID per 100,000 population. And some parts of Gauteng are epicenters, parts of Eastern Cape, parts of Western Cape, and parts of KwaZulu-Natal are epicenters. So that guideline, for instance, says if people are coming from those areas, then you need to quarantine them for 14 days. We also had a guidance we put out on the utilization of PPE. In the mining sector, PPE is quite used extensively, especially dust masks, which in this case actually are also of value in that they have very high protection on dust and on bacteria and viruses of this nature. And therefore, those people that were already issued with the dust masks, it meant they actually have protection. But we then ensured that all our employees utilize 3-ply masks, which are reserved for health workers. And that was because we believe that the mining sector is at a higher risk, mainly because we have got congregate settings. As you might be aware, with the TB epidemic, mining is usually grouped with prisons, for instance, because of the congregate setting. And if you have been following, there is a massive outbreak of COVID-19 in the correctional services, to the extent that they are releasing prisoners beforehand because it is too congested. So in our circumstances, we identified which are the areas which are, likely to be congregate settings. These vary according to companies and how they operate, and generally the industry works on a risk-based approach. Each company has to assess its own risks and then apply measures to mitigate those risks. And so our advice is more generic, but as I said, we said the minimum we will accept in our industry will be 3-ply masks and not cloth masks, for instance. Our last guidance was on vulnerable populations. As you are aware, most of us will contract the virus, but we might be asymptomatic or we might have mild symptoms. A few will then need hospitalization, but a smaller number, about 5%, they might need ICU care. And this is usually the people that are vulnerable. And we all know it's according to age, it's according to morbidities, HIV, mainly, in fact, let me start in the order. It's hypertension, diabetes, cardiac disease, HIV comes along in our case. So we have that guidance which says, what do you do with those employees? How do you ensure that you protect them? Because as much as we have had a lot of cases in the industry, we have actually had mainly asymptomatic transmission. And the key is that we should protect the vulnerable people, because if we don't, they are the ones who are likely then to lead to deaths in the industry. So all of these interventions, the key things that they were talking to, the documents I was talking about, they are talking on prevention, they are talking on risk assessment of the workplace and the vulnerable employees, how to manage cases, quarantine facilities, a lot has been done there, and collaboration. We believe that collaboration is key. COVID is a national global epidemic, and no party can handle it alone, but neither the private sector alone nor the public sector. And therefore, we need to collaborate at a regional basis with the district on how to control the disease. Additionally, we have what is called Kumbule Kaya, where it's about reducing fatalities in the industry. It was an existing program, and we repurposed some of its funding to address COVID, because we knew that it is going to result in some deaths, and there is work that is now done on behavior training, on the mapping of the disease, and on research. I will not go into details on the research. I will only provide details if asked. On the statistics we have on this presentation are old, we couldn't give you today's, but I will tell you what the statistics are today. Today we have 1,229 cases of COVID-19, and of those, 458 have recovered. The other thing on this slide which is of note is the testing rate per population. That is on the extreme right in black. For South Africa, globally, for instance, the testing rate is about 1.5% of the population are tested. In South Africa, this figure is 1.98%. In mining, it's 2.7%. We are just illustrating the fact that we are testing more than the average. And at the bottom of this graph, I want to update you to say we have most cases currently in the gold sector, 584 cases, followed by 502 cases in the platinum sector, and 67 in coal. Coal had actually been lagging behind for some time, and in the last week, they have experienced a number of cases in their operations. On the following slide, it's just to show you the trajectory of the disease. You will see that it's fairly similar to South Africa, where it goes up. And all predictions are that we are only going to peak in South Africa in July. And so we will be expecting that these numbers will go up. We can go on to the next slide, which again is just a closer look at how our cases have evolved. You will note that the blue bars is the number of cases. So in some instances, we had a number of, let's say a company would screen everyone, or there is a bit of an outbreak and they decide to do a massive contact tracing. That's how then you'd get that large number of maybe up about more than 100 people reported in one instance. But if you look at the graph overall, it is steadily going up. And we have also noted, of course, that it also is linked to the lockdowns. At level 4, there wasn't much happening. And then after level 4, at level 5, there wasn't much happening. But then at level 4, then you started seeing the increase in cases. And this is typical of any epidemic. It goes with economic activity. Economic activity means people move around, and therefore that's how disease moves around. My last two inputs will be on the context for the high numbers we have of COVID cases compared to, let's say, the district in which the mine is. And I have to say, actually, at this stage, that most of the mining provinces have some of the lower testing rates compared to, let's say, the Western Cape, which has the highest testing rate per population. The Limpopo, Mpumalanga, Northwest, which is where most mines are, they've had fairly low testing rates. We do have more screening, which is daily, of course, and testing, as I indicated, where our rate is about 2.7% compared to 1.9% for the country. And so when you test, then you do find more people. We have also had a few clusters, which or mass testing, where a mine decides to test everyone. And whenever you test in any society now, community now in South Africa, if you decide to go and test Khalashawa, location, you will find a whole lot of people that have got the disease, but are even unaware that they have got the disease. We also have intensive contact tracing. So whenever there is someone who is positive, then there is a chain which is about tracing everyone they were in association with, and those usually get tested. My last inputs then are on the testing, and this has been a sort of bone of contention. It is understandable. Most people would love to know, if they've got the disease or not, because we believe then that will be able to stop transmitting it to other people. But, there are many other realities around testing. Currently, the department advises that people are only tested when they have symptoms. They have even now narrowed it to say people who must be tested are those who are going into hospital and health workers. And this is due to the massive backlogs which are in the system, because there is a global shortage of testing material. And so in the mining industry, we do try to stick to that, but we do go beyond, on a number of in a number of areas. I won't go into that unless I am asked. The companies are actually looking at boosting testing capacity within the companies and also within the regions. And then a few of them have actually already bought machines, and some have supported either maybe existing laboratories to, add capacity. So there's a lot of capacity that has already been added by mining companies to testing. But maybe the parting shot really on testing is that, unfortunately, it doesn't assist or it's not a panacea. You can test today and you're negative, but tomorrow or next week or the other month, you might be positive because you are living in a community where the virus is circulating, which is why then still we say our biggest interventions should be around the prevention, which is the ones that we know. I will not mention them. Thank you very much. I will hand over to my next colleague, Mutsamai.
Tutula, thanks. Matsamai, do you want to come in here?
Thank you, Roger. Good morning, Chairperson, and good morning to members of the Portfolio Committee. Since before the lockdown, and it was somewhere in early March, after the first coronavirus case was detected in South Africa, the Minerals Council, as part of broader business and under the auspices of BUSA, commenced engagements with NEDLEC social partners in order to engage on the setting up of the UIF COVID-19 test benefit, which you probably all know about now. And it was very involved engagements where we are attempting to make sure that its early startup would be successful and it would be seamless and that there would be least problems. And we have been engaging twice a week since that date to try and iron out any problems in relation to the administration of that benefit, just to ensure that our workers are paid in instances where companies have been adversely affected by the pandemic to the extent that they are unable to pay the salaries of employees. What we've also been doing throughout this process is we've been engaged with members in assisting them, first and foremost, giving them guidance on how to deal with employment-related impacts and effects of COVID-19, but also we've been giving them guidance on the interpretation and implementation of the various disaster management regulations and directives that have been published since the lockdown. At some stage, and it was, I think, around the 16th of April, mining was allowed to resume production at 50% capacity, and we had issues around ensuring that mining companies would be able to safely and successfully transport employees from the labor sending areas such as the Eastern Cape and KZN, etc. And the mining industry got involved with our partner agency, DEBA, in ensuring that we facilitate the safe and seamless passage of those employees to the mining areas. Part of the issues that we were dealing with at that stage was the issue around permitting, where we created a standard format for the mining industry to use in order to ensure seamless passage through roadblocks. We also had originally experienced issues in relation to taxi associations where we had difficulty in terms of mining companies transporting their own employees in buses, but we engaged in negotiations together with DEBA, with the relevant government departments to ensure that that issue was resolved, and indeed we were successfully able to resolve it. What is currently happening, Chair, is that the UIF test benefit is experiencing a number of issues which we are involved on a daily basis in trying to resolve. The one thing that I think is important to mention is that most of our members of the Minerals Council, opted to pay the full salaries of employees during the first.
You are left with 5 minutes, Mr. Roger. I added the 5 minutes because of the technical challenges we had when we started the meeting. So you have got 5 minutes to wrap up.
All right.
Thank you very much.
In that case, Chairperson, I'll just close on this note because there's another issue on the return of mine workers that still needs to be covered. Thanks, Nix.
Nix, you want to come in here, please?
Thanks, Mtamai and the team. Good afternoon, Chair. Good afternoon, honorable gentlemen and ladies. We have prepared a plan for the return of foreign mine workers, which we submitted to the National Department of Health. And the National Department of Health gave us a set of conditionalities about the returning employees. These relate to that the workers need to be screened in their home countries. They need to be transported through the border gates through a facilitated process. They need to be transported to the accredited quarantine facilities. We presented this plan to the NAT joint early this week, and the NAT joint in principle agreed to the transportation of the employees, but requested further information regarding documentary evidence regarding the quarantine facilities, the person receiving the employees, the medical and psychosocial services that are available at these quarantine facilities. And that information is going to be provided to NAT Joint, and I'm going to be presenting to NAT Joint this afternoon at 2 o'clock about that. So the employees, about 3,500 employees in Mozambique, and about 8,000 employees in Lesotho who are prepared to come. But the border post in Mozambique can only process about 400 employees per day. So we're going to take over 2 to 3 weeks to process the employees in Mozambique. And in Lesotho, there are close to 8,500 employees. And the 3 border posts, each one of them can only take about 130 employees per day. So that's going to be much longer, over a 20-25 day period to bring the workers back. And that plan is supposed to be endorsed, and we give in the directive by NAT Joint later this afternoon. Thank you, Chair.
Thanks, Nix. Let's go to Bella quickly on the support of mine communities.
Good morning, honourable members. Just very briefly, I think the COVID-19 pandemic has really exacerbated the inequalities that exist in society, and these were certainly felt by our community. So mining companies had to come to the assistance of our mining communities. And they've done so in a strong way, and in addition to certainly continuing with their SLP commitments, have been providing facility assistance with things like equipment for testing, as Dr. Tutula has mentioned, the provision of PPE and critical medical equipment. This has been done in conjunction, working with district municipalities. Water has been a critical issue, so mining companies have actually come to try to help communities with the provision of water supplies, utilization of water tankers, and water in public facilities, which has been absolutely critical. And food parcels have also been something that have helped those in need, in particular vulnerable communities in these times, these challenging times. Honourable members, we've also provided you a document that actually talks to the details of how mining companies have been assisting communities. So the details there for you to read. Suffice it to just say, maybe in closing, that with the opening of schools, we are also engaging with the various provincial departments to see how we can help them with the educators and the learners. Thank you, Chair.
Thanks, Bella. So last couple of comments, Chairperson, to you and the honourable members. We've seen about a 45% decline in mining production in April, which is a very big hit on the sector from a production point of view. That's obviously because the sector was under the lockdown period. We are starting to see, obviously, a lot of companies. We've had some 260,000 mine workers that have been screened and brought back into the sector. This just illustrates a number of the different commodities that have been hit. I'm not going to go into the detail. We can chat about that later. What I did wanted to just quickly conclude by saying is that the industry has been doing a huge amount of work working with its partners in organized labor, in government, in helping to manage the pandemic. The fact that we're doing a lot more testing, a lot more screening, so just that point, around 260,000 returning workers being screened, more than, I think it's 14,000 tests have been done in the sector. The fact that we're picking up cases means that our systems are working. The fact is that there are many other sectors of the economy that are not doing the same level of screening, the same level of testing, and if they were, they would be picking up a similar type caseload coming through the system. But our systems are working, the quarantine systems are working, the tracking and tracing systems are working, and we are working well together with the different key stakeholders, particularly government, organized labor, to help manage this. And again, last comment is it's all about saving lives and saving livelihoods. Honourable Chairperson, back to you. Thank you.
Thank you, Mr. Roger. You made it exactly in the 5 minutes that I gave you. Is UASA in? Is UASA in?
Yes, Chair.
Can you take your 10 minutes, please?
Thank you very much, Chair. Chair, before I start, I just want to apologize on behalf of our CEO, Mr. Jacques Higu, who was supposed to attend with me, but unfortunately, due to an urgent NETLAC meeting to deal with the transport sector, he couldn't make it. So please accept the apologies. There's no malice in not attending to your meeting. Chair, from our side, I want to start off by saying that the mandatory code that was published by the Inspectorate and the Honourable Minister was received very well on our side. All of the mines where we have members has implemented the code and is aligned with it. The challenges that we have encountered is the asymptomatic cases, and that is problematic, hence the request from our side that random sampling must be done so that we can work through the labour force and not just in terms of the normal screening and symptoms. There is, however, another challenge, and that is that some of the companies, there's a lack of proper consultations, and I'm not going to mention names at this point in time. Then the other challenge that we're sitting with is the amended COIDA Act. At this point in time, only deals with people that has got cases that are test positive, and then they can claim through COIDA or Rand Mutual. The problem that we're sitting with that is the fact that at the end of the day, there are some of the employees at this point in time that are the so-called vulnerable employees that cannot return to work. But unfortunately, they sit with a situation where they can't get their salaries in some of the mines. Hence the fact that from our side, there is a plea from our side to the PPC to say, can we assist to try and look at the amendment and include the vulnerable employees whilst they're sitting at home and waiting to be recalled, please. There is another point, and this is the situation with the marginal mines. How do we deal with the marginal mines at the end of the day? Because some of the marginal mines does not have the necessary financial backing to comply with the necessary guidelines. And I want to mention a specific mine at this point in time, and this is Village Mine Reef in Klerksdorp at this point in time. They sit with a typical situation that they do not have the money to start up, and hence the fact that they cannot pay their employees. So at the end of the day, what we're sitting with at this point in time is the Section 189 that they have called. At the same point in time, people doesn't get any money, and there is a hell of a lot of problems there. And they started with protesting and everything there. So from our side, from UASA side, we request that if possible, if the PPC can look into the situation of the marginal mines, please. Chair, then we sit with the last point I want to mention, and this is the basic the situation of where we sit with the Section 189s that are called by various mines and dealt with. I know that the Honourable Minister has asked some of the mines to retract those notices, and some of them have retracted it. But at the end of the day, there's some of these mines that they just didn't withdraw the notices. So we're sitting with a situation When we go to the CCMA for the Section 189 retrenchment consultations, we sit with the interpretation of the MPRAD on the one side, and we sit with the situation of the Labour Relations Act, especially Section 210, which is quite clear to state, and I'm going to read it for you. If any conflict relating to the matters dealt with in this Act, meaning the LRA, arises between this Act and the provisions of any other law, save the Constitution or any Act expressly amending this Act, the provisions of this Act shall prevail. Now, we had a couple of court cases that has pronounced in favor of the LRA in terms of Section 210, and therefore we sit with a situation where during the COVID period, we have mines that have called the Section 189s, and we have to proceed with them during this point in time. And that is a huge problem that we do have in terms of the sector at this point in time. Chair, that's all from our side. Thank you very much.
Thank you very much, UASA. You were even more conservative with time. Thank you. You are making the work much more easier. Solidarity.
Good morning. Thank you, Chair. Good morning.
Take your 10 minutes.
Thank you, Chair, and good morning also to the honourable members of the committee. Chair, just to commence with our presentation, just with us is Paul Marden. He's the Deputy General Secretary for Solidarity, responsible for health and safety and sustainability, and Peter Burger, responsible for the sector coordinator, responsible for mining. So what we will deal with is quickly as the impact on mine workers, matters of concern, good stories to tell, and then a few general comments that we will make. First of all, if you look at the impact on mine workers, which is obviously our main focus, is despite the fact that some of the mines were able to still operate, especially the Eskom coal mines, and care and maintenance related services, essential services, all the workers were still hit hard, but especially the contractors, because a lot of the mines, they use a lot of contractors, they were not able to start working again, and there's no pay principle, no work, no pay principle had a major impact. Then, prior to COVID-19, the effect, workers were already under huge pressure regarding possible job losses due to Eskom factor, etc., etc. So we're sitting with a situation where there's also additional costs that is coming in now that makes mines even more vulnerable. If you look at the PPE costs, one company like Sibanya told us is 90 million rand a month extra that they pay. And the coal sector, especially the small coal mines, there's about 9 of them that we're busy consulting on 189s, so they're extremely vulnerable. Then, if employees are not receiving a salary, you cannot restructure their debt because you need to restructure their debt in terms of income. So a lot of employees are facing sequestration. Then there's the stigma around having COVID-19 and being in contact with other people, where some of our members told us that they simply don't want to declare with whom they were in contact with because they will put other people out of a job. So there's a lot of stress also. If you're contracted, are you part of the 5% that's going to be critically ill? Is there sufficient services? Then your mine workers have the normal problems like all other working South Africans. They have family at home they need to look after. They have logistical challenges. And then obviously you have a challenge that if you cannot prove that you attract COVID-19 at the workplace, then it's not an occupational disease. And all of that culminates in a lot of mental health challenges that workers are facing. And yesterday, the MEC of KwaZulu-Natal for Economic Development disclosed a very important report on the increase of especially mental health around what workers and employers are experiencing, and it's something that's underestimated. Then if we look at the concerns, Chair, a lot of fake news going around at the workplaces spread by various people about certain cases. Obviously, it creates a lot of uncertainty, and we're sitting with this challenge. We want to ramp up the mines to get income for all social partners involved. On the other hand, there is pressure, and so it's just as difficult, quandary that we're sitting with. And then there's challenges, obviously, and have social distancing cages and the face, but we're dealing with it, but it's nevertheless a challenge. The comorbidity increased risk is high in mining, obviously another challenge. And then the biggest challenge is to get 450,000 people to work, because the most critical part is that area where you move from your home to the workplace, and that's a critical area to manage. And then there's about 40% of the people being tested as asymptomatic. And obviously, you know, that increases your risk. And obviously, there's a concern that if we hit the peak, that we will fall behind in testing. Another matter of concern is, screening protocols outside the mining area. So before people enter the mining gate, you know, the test that's been taken there, we're not sure if they've conducted in the correct manner. We had a few reports of people being test positive. Later, that's been disclosed that they're negative. And our other concern is downstream. If the downstream businesses doesn't open up, there's a lot of downstream business linked to a mining operations, and we're a bit concerned about the DTI, that they don't give us proper support so that we can open up all those factories that's downstream. The TARS issue, UIF, it's a major challenge for us, and it's late payments, wrong payments, and a lot of disinformation spreading out of that as well. And then we're starting to deal with a new challenge where our members start to complain about the impact of wearing a mask the whole day. So those are new challenges we need to deal with. We deal with employers. There's sometimes a lack of communication where they will consult at the regional level, not at national level or otherwise, around people being positive. And then obviously there's a concern if we hit the peak that some of the mines and mining areas will revert back to level 4. And then obviously we're also sitting with the challenge that sometimes the smaller unions are excluded from some of the consultations, and but that's something obviously we deal with. Good stories, obviously, as soon as the mandatory code of practice was introduced, it improved the regulatory certainty and uniformity. But I must say, before the guidelines, we had a lot of interactions with especially the Honourable Minister Gwedi Mantashe and his department, where they consulted with us on health and safety related matters. Likewise, the mining companies, especially the big mining companies, they were very proactive, and they were doing more at that stage than what the code of practices are at this stage prescribing. The risk-based approach and the worst case scenario planning is very good for the rest of the country to follow. And in the meetings we have with the DTI, we say they must follow the blueprint of the mining industry. Also very good that there's now a focus on health. We always talk about health and safety, but health has always been a little bit undermined in this regard. And then suddenly, you know, there's a bigger focus. And our members are also, whenever they work in a mine where they have everything in place, they accept it as a new normal and they go back to work, and there are no further issues. Then just the next slide deals with Sibanye especially. They've done great work. They invested 14.5 million rands in local business support. They invested a lot in getting local suppliers to deliver PPE. It was already mentioned about the water tanks that they're placing, the blankets they're handing out. So the real credit to Sibanye-Stillwater in that regard. The same with Kumba Iron Ore. Wonderful initiatives in the Northern Cape where they have set up laboratories in Kathu and Postmasburg where they're testing 500 people a day, and they have also very good facilities, quarantine facilities for the whole community. It's not only the mining community. Furthermore, you know, the workers, most of the workers are safer at work than they are at home. So it's wonderful also for the testing that the mining companies are doing. Mining houses, we see how they share resources, especially around the Free State, Rustenburg and the Northwest areas where they have these facilities where they work together. And this new focus on health will mean that you'll have a healthier workforce, and all those lifestyle diseases will be detected earlier because of this. And we said, look, there should not be stress or tension between healthy work and health or work. It should be healthy work. And then we also appreciate those instances, especially in the beginning, where people will pay full salaries. Now we're obviously sitting with challenges. But there are also advantages. The gold price is good. The Northern Cape have got very limited cases, low infection rate in the Witbank, Kriel and Middelburg area, where you have some of the coal mines that at least assist a lot with the pressure that the mines are under. But the fact that you have a low level of positive cases helps us in the Section 189 processes. Fatalities obviously reduced by 29%, which is obviously good. But the mining in general is in a much, much better position than any of the other industries. Then my last two slides to finish off, Chair and honourable members. These are just things that I'm sharing with you. These were union requests that we submitted, and we deal with the companies every time. We don't need your help. We're just basically saying these are the challenges we're dealing with. First of all, we want the shop stewards to be trained as inspectors. So in Sibanya are using the shop stewards. They actually made the shop stewards responsible to go around to look at compliance or non-compliance. Then we have the social partners that must be more aware of the risks and assess the risk outside of South Africa. So if we hit the peak, that there's no overreaction in these cases, that we know there's going to be an increase. This is happening all over the world. But we want mines to involve us always in the planning. Those that they will do it, involve us in plannings with those companies where we sign protocol agreements up front. They're just so much less tension whenever we hit a situation where there's a crisis. We want speedy and accurate information. We don't want to hear it through the Minerals Council, but we can understand it must be centralized. But sometimes, you know, all politics is local, and then we want to deal with the local level. And the big challenge is we don't want to read in the media what is happening in a mining house, and that's also what we normally put pressure on the companies to let the unions know first what's happening before we read it in the media. My last slide, Chair and Mr. Baxter referred to the black swan events. We are a bit concerned that there's from various social partners a total overreaction to crises, and we have at the big mining houses actually plans in place how to deal with a crisis. If there's suddenly 200 or 300 or 400 positive cases, that must not be a failure of the system. That must we must work within that plan. And then the hotspots must be identified, focused on, but very important, the Department of Health must always be included if there's a crisis situation. They are the custodians of the process, and we have noticed with Anglo Gold Ashanti, especially, who used the Department of Health extensively when they had their crisis situation, how much does it help to have the Department with authority and the necessary skills and expertise to guide us in that regard. And then my last 2 points, you know, and this came from our female members, and that was where they said, you know, that spacing measures in the cages, especially something that must remain. You know, it's a very uncomfortable situation where people cramped into a cage. There was comfortable situations that the female mine workers sometimes find themselves in, and this is one of the practices that they are hoping.
Thank you, Solidarity.
And that's all from our side. Thank you very much, Jane.
Thank you. AMCU, can you please help and put it on the screen? AMCU, can you take your 10 minutes? Are you here? No.
Hello, I'm having a problem of a network here. Is Kolani Bogoloshe, the National Chairperson of Health and Safety. Okay, I'm not going. Sorry, Chair.
Continue, take your 10 minutes.
I'm not going to do the presentation. Comrade Matthew Grant is going to deal with the presentation.
Okay.
Over to you, Comrade Matthew, to save time.
Thank you, Comrade Bokoloshe, and greetings, members. Can everyone hear me? Just to check, Chairperson.
Yes.
Yes, we can hear you.
Thank you.
Yes, I hear you.
Thank you. Thank you very much. My name is Matthew Grant, UMCO's National Health and Safety Officer. And greetings, honourable members, honourable Chairperson, and comrades and colleagues. I'll go through the presentation. I have With me, Comrade Xolani Bokoloshe, the Chairperson of Health and Safety, and Comrade Gabriel Nkosi, our National Health and Safety Coordinator. Honourable members, the presentation we have to make today is very brief, and I'll be to the point. I trust you can see what's on my screen. Let me just get it sorted. So we have a number of points that we both agree with and disagree with, of course, but we acknowledge the important roles that mines are actually playing in the current crisis that we face. We do note the important element of the employment in the industry, and we are looking forward to the mines being ramped up to full production. We have many reports that we have received of many mine workers losing their jobs as well, but it is worth noting that this is a very novel and fast-moving situation, so we all need to be coming together to solve it. Honourable members, we believe, and it is our position as AMCU, that focused universal testing of mine workers and peri-mining communities is a vital measure, and we've heard what the Minerals Council has told us about testing. We do understand, and of course we are sympathetic to the difficulties around testing everyone, the scientific gaps in it as well when you test and when you get the results back. We still have a position that having an idea of the prevalence of COVID-19 in the industry is very vital to us all together to address it. So we all know on 27th of March, the national lockdown happened, and I'm moving just to my first point on the slide. At that time, no mine worker tested positive that we know of. Under alert level 5, at 50% capacity, certain mines could operate and perform care and maintenance, but there was only one positive case, and that was at Afrimat from what we recall. At the 50% capacity, from the labour sending areas, mine workers were brought back, and many were brought back without being testing, as reports that we received. And it did increase some of the numbers and possibly led to some of these outbreaks we've seen, like Mponeng, although we're still waiting to get more information back on that. The concern, obviously, to us, and at this point I'll state it again, is any hotspots that might creep up or outbreak in a mine. And a main challenge we all need to come together to deal with is the agility we have to manage that situation. And Mponeng, I think, woke us all up at the need to quickly resolve it, because it can spread incredibly quickly, and usually by the time we find out, we can be 4 or 5 days behind the infection rate. Currently, honourable members, we have some reports up till today of some of the mines who are not providing employees with hand sanitizers, not disinfecting certain working places, especially if there's been a positive case, including underground. Employee transportation, so the buses and other transportations provided, some members are reporting that they are just being recirculated and not being disinfected after each use, and that can be a real problem. Some employees have been asked for themselves to pay for their quarantine facilities via their medical aid. We don't agree with that practice. And some have been asked to pay for some tests that have been needed to have been conducted via their personal medical aid. We also don't agree with that. These are some of the reports we've received. Additionally, many reports of shortages of PPE, and earlier on, many workers being instructed to reuse disposable masks. And that's a big problem, and maybe some of those issues have been sorted out in some of these mines, but we do still get reports of shortages of PPE. Then employees who have contracted COVID-19 whilst at work sometimes are blamed and advised to take their annual leave, and that's just a practice that mustn't be done. Yes, sick leave must be used, but annual leave is being used as well, and then unpaid leave. No work, no pay principle is being applied. We also don't agree with that. And these are challenges that we need to come together to solve. We've also had reports that some employees are told that if they are needing to be quarantined or in isolation and using up their leave, they will be needing to work back over the Christmas period to make back some of the production that they've lost. These are various reports all over the place, and it is of concern to us. Then, honourable members, we do just make the following points as well before I move on to our recommendations. We do need to realize that many mine workers support a great number of family members, on average about 10. So them being back at work is vital to get pay, to get an income, and to support the welfare and the well-being of their family during this crisis. Make sure they've got food on the table, make sure they are in an adequate position to provide medical care to their family members. So it's very important that we work together to ensure that is taking place. So we're pleased to hear about the progress being made on the Minerals Council side with Lesotho and Mozambique to get workers back. This also, if I move on to the recommendations, Honourable Chairperson, we think that all mine workers obviously should be tested. That is our position. We understand the difficulties that we have with this, the challenges. The retrenchments that we're currently seeing, and we also understand the challenges with that, but we do think it should be suspended during the epidemic. I mean, the impact of retrenching a mine worker on their family and their greater community during this epidemic is quite vast. All mines obviously should clean and disinfect workplaces. We've still received reports, and this is of great concern to us. So we do ask the Minerals Council, and we are informing yourselves that this is something that must be closely monitored. Employee transport, mining accommodation, and obviously proof of such disinfecting should be shared with organized labor. We do need this to be, employees need to be made at ease that this is happening. And contractor employees should be sufficiently protected and catered for during this time as well. And we have been seeing that some contractors are being neglected in certain ways, especially around healthcare of their staff as well. And that's a very glaring gap if it's not adequately addressed. And I think on a good note, Chairperson, there is a real chance for all mining houses to better deal with employee healthcare management. In the past, before this outbreak, we always weekly get reports that employees are not duly informed of what conditions they face. They're not being communicated properly. Informed consent is a big issue. And this is a chance for all of us actually to make sure that employees have the correct communication, accurate communication about their own health and how it might affect their family. And it's a chance for us to really up our game across the sector on employee healthcare management, especially with communication and making them feel at ease. I think I will stop there for now, Chairperson, and maybe hand back to my Chairperson if he has anything to add, or Mr. Nkosi as well. Thank you for your time.
No, thanks, Comrade Grant. Thank you very much for representing AMCU in this presentation. I think, Chair, just to add a few comments before the time is finished. What we are experiencing is that whatever that has been said by Chamber of Mines is not correct, because what we have seen in these mines are not ready to comply. Some of these mines doesn't have quarantine room. Some of these companies got a problem of the PPE, especially the mask and the sanitizer. So to us, it is clear that they are not ready. And Chair, there's also an issue of the 50% that's still not yet been recalled. And this 50% is the people are frustrated because this employer are using tactics to recall the 50% that it will take up to 3 months or 4 months to call the remaining 50%. Surely that, to us, it shows that this is the number that is going to be taken out end of the day. So we like to request the portfolio committee to assist. This is the disaster that is facing the nation. The employers cannot put the blame to workers. Workers done nothing. It's affecting all of us. So it's important for all of us to deal with the problem that we are facing. Not these employers to say, these mine bosses, that if we don't get the profit, then we'll cut the numbers. The gold is still there in platinum because it was not been removed from underground. So I don't think it will affect the workers. So in these words, we thanks for the invitation and we appreciate to be given a platform. Thank you very much, Chair.
Thank you. Thank you. We call it Matthew in Zulu. We say thank you, Mateo.
Thank you, Chair.
Babu Pogolos. NUM. Ariko and Boss, is NUM in?
Thank you very much, Honorable Chair.
Yes, take your 10 minutes.
I will take 5 minutes of my 10 minutes and hand over to the Deputy General Secretary of the NUM for the other 5 minutes. Chair. Good morning, everybody. Ours is just to give a brief response to what has been tabled by the Minerals Councils of South Africa. Indeed, before the lockdown, we sat down with the Minerals Councils and they briefed us on the program that they were intending to follow during the pandemic. We appreciated that. But going through the lockdown, we rarely met with the Minerals Council. But we met with the individual companies under the Minerals Council, although some of these companies are law unto themselves. If I may mention Sibanye for that matter, I don't have to fear that. We hear that Dr. Balfour from Mincosa says the correctional services are releasing prisoners before time because of congestion. And we know very well that the mining industry is a labor-intensive industry, very much congested. Yet we are doing the opposite, bringing back more people. At the end of the day, there will seem to be more cases in the industry because of the congestion. However, we had to balance the situation because if people were to stay at home longer than they have stayed, that would have affected their what you call earnings. And we said, in as much as we agree that gradually people must be brought back to work, but extra precautionary measures have to be taken. There's this one thing that is almost impossible in the industry because they want to save on electricity. Social distance. They can't put people who will be a meter apart in a cage, in the deck of a cage, because they want to save on electricity. And we say, now it shows that they are more interested in profits than saving the lives of the people. And we still insist that if they don't observe social distance, that will contribute hugely in the spread of the virus in the industry come the few months, because we are told that by July, August will be reaching the peak. The reasons will be that more people will have gone back to work and there will be less social distance. If there are regulations regulating the taxi industry that you have so many people in a taxi, why can't our regulations dictate that we have so many people in the deck of a cage? If only 2%, 2.7% of people in the industry have been tested, and we have this huge number of 1,229 people testing positive, it means once we test more than that, definitely the numbers will be high. And I'm shocked to hear from Dr. Balfour that the reason why Western Cape has got such a huge number is because they are testing more. It means where they are said to be lower infected people are not being tested. And we are told that it's the very same government that says the testing kits
must be saved for those who show symptoms. Whereas you might find that many of those who don't show symptoms are the ones who are spreading the disease. And the issue of tests, we were raised with companies that, man, in as much as we expect you to apply for your employees, but as we are waiting for UIF to pay, can you pay from your coffers so that when UIF pays you, you pay yourselves from that? Unfortunately, we could not agree with the companies on that. However, we're delighted to learn that as far as one company under Mincosa, Harmony, is concerned, they have been paid 69 million of TERS, and they have paid to 13,446 recipients. We hope the other companies under Mincosa are doing as much as they can to make sure that their employees benefit from the TERS. We are worried, Chair of the Portfolio Committee, about the impact of this lockdown or of this pandemic on some of the smaller mines, as Franz Stechling had said. If you look at the companies like your VMR, we see chaos there. As we speak, people are not being paid. The company has not recalled a single person. And in fact, the company is intending to retrench. We are not sure whether it's retrenching and is closing down. But if there's still gold there, they must just hand over the license to somebody who can mine that area and create jobs. In those few words, Chair, I'll hand over to my deputy to present on the especially the platinum sector. Thank you.
Chairperson, can you hear me? Let me not waste time. I take it that the General Secretary of NUM has, on behalf of NUM, greeted you. Let me say that we understand that the pandemic was not an invitation by anybody. It is something that we did not know that it is going to come. And we needed to take it that when we raise concerns, it's not a matter that we are fighting anybody. But we are just saying that we must take responsibility and respond and manage this pandemic in a manner that we will not be wounded. But let me appreciate that despite the challenges that we face, there are many companies that prove to us that they are very serious. For example, if you look at in the platinum sectors, if you look at the companies like Anglo Platinum, to be honest, they are doing their best. They are doing whatever they can. We all know that, well, platinum is not a much problem in terms of the current situation, but the areas where there are challenges, one of the areas that we have got challenges is the chrome. Even prior to the pandemic, we all know that chrome was under pressure. But for chrome being under pressure, we don't take it that chrome mining houses must take advantage of the pandemic, because majority of the Section 189 that our colleagues we're talking about comes from the chrome. And we urge the DMRE and the relevant departments to assist us, particularly in the chrome, because in all the mining in chrome, we do have Section 189, and we can't avoid that. And their most concern now is that they want the summer tariffs, because if they can't get the summer tariffs, particularly in the smelters, they will not make a living. And we urge that we need to assist each other in that space. So if we can assist each other in that space, we're hopeful that we can arrest a lot of Section 189 in that space. And then in other areas like your diamonds, we all know that the market of the diamonds are also problematic, that majority are based in China. And as we have the problem, it means that the majority of the diamonds mines will then raise an issue which says that we don't have a market. And when all our places that we sell our diamonds are closed, where are we going to sell the diamonds, irrespective that we can take the operations to 100%? The reality of the matter is that we are not going to make any breakthrough because we will not have an income, and nobody is interested at this stage. But we are hopeful that at this stage, despite the fact that they are under that pressure, for the rest of the 3 months that we are in, all of them then confirmed that they will still pay the June salaries. And we are just saying that we are still managing. But if the situation extends to July, August, we are not sure that whether they will still be supportive. I think the majority of the comrades from Labour, AMCU, Solidarity, and UASA, they did raise the challenges that we are facing in terms of TERS, that because companies are hiding that they've never received the TERS, particularly the May TERS that they've applied, that they must pay salaries in June. And we will plead with the department that they must also assist us in making intervention with the Department of Labor as to where is the backlog, how the backlog can be resolved within a short period of time, because we know that is what many employers are going to use as a scapegoat for not paying salaries. The last issue, Chairperson, your department is weak in response. If you can, I think the Labour, they tried to generalize and not pinpoint certain mining houses. And we don't want to also to generalize that all mining houses has got problems. But your department, they are not responding. If you, for example, we can show you letters as NUM that we then did send to the DMRE and say, in these operations, we are not happy. The engagement between the branch committee and these companies are having challenges that they can't resolve issues. And when we then ask the department to intervene, they are very shy. They are very, very shy. I don't understand why did you employ people that are shy to do their job and pay them. So if you want to quarantine them, you can quarantine those inspectors, where possible not pay them, because they're not doing their job and they have not tested positive. We thank you from NUM.
Thank you, NUM. Thanks to the Labour component. Thanks from Mincosa for the presentation. I'm sure as I go to honorable members, let me deal with these following protocol issues. The main purpose the committee invites people is just to get a sense of whatever developments that would have been the reason for inviting that person to appear in front of the committee. At times it's for information sharing, at times is to ensure that where there is a need and the Committee of Parliament is allowed decisively to intervene in certain areas, it must be able to make that intervention. Lastly, sometimes it's for accountability purposes, that people must be able to come and account. So you can be invited to the committee when it's nice, but also at the same time, the invitation could be on the basis of not so good to appear. But I think at this stage, the main reason is that we thought it's important to get both sides in terms of the presentation, so that they always say politics are run through perceptions. If you can't manage perceptions, then the risk is very high that you will always be trying to defend what sometimes could be indefensible. So the main reason we thought that we must be able to ensure in the minimum and the limited space of time, we must ensure that the stakeholders in the mining sector were able to invite them under one roof. So it may not be an ideal situation, but we think the mere fact that we are under one roof, we are talking, it begins to lay a foundation. Having said so, we want to also just to say it will be much appreciated to have more of an interactive. So it's for members of parliament, specifically in this committee, to have an understanding of what is happening. Now, can I then, before I go to these members of parliament, make a request, a very simple one. At least I know some of them now. It's more than a year being together. Can we focus on getting the necessary information that we want? Give all the due respect to the people who have invited to the committee. I don't want, you know what I mean, honorable members. I don't want a situation where just by virtue of a person honoring being invited by the committee to appear in front of it, feels that that invitation had only one intention, either to undermine, humiliate, disregard, or whatever that is possible. I will never limit a member of the committee to ask any question, to make any views, but can we not ridicule, even not ridicule each other, even as members of the committee? Respect people that we have invited to appear in front of the committee. I always say, don't invite someone to see how bad is your family when you have a function. Let's respect the fact that there will be people who have invited from outside. Let's deal with the issues. Ask any question that can help us as a committee to take informed decision, in particular with such an important matter, which is not even a matter of national interest. This is a serious catastrophe that the whole world, the globe in general, is faced with. And therefore, in whatever corner where possible, we can find a solution. Let's use this opportunity productively and fruitfully. I will try not to limit honorable members, but request that when, as we ask questions, to our guest also, we'll just tell you what is expected. As you ask questions, please be specific to which first sector, but secondly, specific presentation, or if it's from Mincosa, let it be strictly clear that it's going to Mincosa. If it's going to labor, let it be clear it goes to labor. If in labor, it goes to a specific union, let it be clear that that question is directed to a specific union. I will try to ensure that we are as interactive as possible. I request you, honorable members, please don't take more than 5 minutes in the question that you'll be asking. This means you must balance what you ask from our guest. Please take note of each question that is being asked that you think it is relevant to you. When all members have finished asking questions, we will then give you an opportunity to respond to those questions. Can we do so? I so wish that we can do this up until 11:30, including the responses that will come from the presenters that have made presentations today. If we have not finished, we are all together here, we will make a proposal of how we think these matters can be handled. Can I start with the normal procedure that honorable members know me with? If I did not take correctly, we will start with Honorable Masaule, and then we will go to Honorable Mailam, and then we will go to Honorable Mtenjane. After Honorable Mtenjane, I've not seen which other members are present. After Honorable Mtenjane, we'll go to Honorable Malinga. I'm talking about the ones who were present at the time. Is there any member, Rico and Ayanda, that joined us specifically?
Mr. Mtenjane, Chair.
No, Mtenjane is in. You said is in already. Captain Mtenjane will come after Honorable Mailam. I'm
And
seeing
Mr. Volmarans is in.
Yeah, I saw Mr. Volmarans as well.
Is in. Eh?
We are saying, Chair, Mr. Volmarans is in. I haven't seen Mr. Ngumalo yet.
And Cheryl Phillips has been in.
I know Honorable Phillips is in. So is Honorable Volmarans here? Okay.
Yes,
so
Chair.
It will be Honorable Malinga, and Honorable Volmarans, and then it will be Honorable Phillips, and then will be Honorable Kula. Bawumik?
Chair, I will have to pass.
Okay. Dr. Mailam.
Thank you, Chairperson, and I'd like to thank all the presenters for their largely constructive inputs. Let me start with Mr. Baxter at the Minerals Council. First of all, we note the higher testing percentage than the general population, and that's a really good thing, and I think it needs to be extended and rolled out further. But my question is there more that your members could be doing to assist in curbing the outbreak of this epidemic? What is hindering or otherwise challenging the recovery of this sector? So what's slowing down? What's preventing a faster recovery amongst the mining companies? Then to UASA, I'm just a little bit confused. One of the points spoke about a conflict between the Labour Relations Act and the MPRDA. And I'd really like to know what exactly is that conflict? What's the problem that you're having with those two pieces of legislation that is giving rise to that conflict? And then lastly, to AMCU and the NUM, both unions raised issues with specific and individual mining companies or mines where they said that they were non-compliant. My question to them is, what steps have they taken to deal with those non-compliant mines? What actions have they taken to ensure compliance at those mines? Then lastly, Chair, and maybe this is a more general question that arises to the committee, but I'd like to know, we're having a discussion here today, and my question is, what action will arise from this discussion? In other words, who's going to take what we discuss here and turn it into recommendations and action items, and what's the format of that going to be? Thank you, Chair.
Thank you, Honorable Mailam. Honorable Malinga.
Chairperson.
Am I not coming after Mtenjane, Chair?
Chairperson.
Chairperson.
Wenzani manje Chair, ungivalela ngaphandle.
Don't respond to me. Continue, Babu Mtenjane. Kodwa ngafa Nkosi. Continue.
Wenzani manje, wenzani Chairperson ukuthembe kangaka? Ungivalela ngaphandle manje. Thank you, Chairperson. I wonder if I'm audible that side. Can you hear me, Chairperson?
I hear you, but your network is not good at all from where I'm sitting, but continue. We'll see what to do.
Yes, Chairperson, that is true. That is why I struggle all the way with the network. And half of those things which were said here today, I couldn't hear a thing or two. But anyway, let me try to answer in those that I've heard already. I'll start with the Mineral Council as well. Now, the aim of the Mineral Council, you are saying, is to serve your members and promote their interest. Now, the first question that I would like to ask from you, if you will explain to us what exactly is modernization in mining, because the reason I'm asking this question, it seems like always to us or to me that it seems more like just saving the interest of the capitalism here. Because why I'm saying this is because it is more of a window dressing, what we have heard here in this presentation. It is more of a window dressing. We're talking about the situation whereby we got a serious issue of the COVID-19 pandemic. Yes, we hear what we are doing and we accept what we are doing, but it's not enough. We are saying it's not enough because you seem to be agreeing as a council with the issue of letting all the workers go back to work while there is a serious situation of this COVID-19. We are getting cases every day of the people who are tested positive. The numbers are increasing every day in most of the mines. But to us, it looks like you are also not doing enough. For example, those workers, they've got families. Of all the workers which tested positive already, you did not tell us anything here about going back to their families as well, or trying something to go back to their families as well. Because remember, if someone is tested positive here and he's got a family, once he arrives at home, the same thing will happen to the family. So you don't necessarily seem to be worried about their families as well. You are only worried about them because you are just worried about the profit as well. That is how we put it. Now, also, we did not necessarily hear you as you say your concern is the interest of the people. You should have realized by now that many workers does not have medical aid. And you don't tell us here what do you think of doing as helping them so they can get medical aid, because you should have seen by now that how difficult it is if a worker does not have a medical aid. For example, we are dealing with many more other diseases other than this COVID-19 issue. There are many more other diseases in the mines, which I believe that you know them better. But you are not, you know that there are mines which got workers who does not necessarily have help when it comes to when they are sick, then they want to go to hospital and get help and all those things. In short, the workers does not have medical aid. You are not telling us to assist them to have medical aid, because medical aid is not a privilege, but it's something that someone must have, especially a person who's working and is working under these conditions that they are working under in the mines, because we all know that in the mines, the situation there is not conducive at all. It's a very rough situation for a human being to be under. But because they are working, they have to go there. But yes, indeed, they need to be protected and have something to protect them as well. And then to go further, there are many complaints that we get, Chairperson, from the workers themselves in all the provinces. For example, in the Northern Cape, we also already got complaints from the Kuruman mine, Kgalagadi mine, Tsipen mine. We got complaints about those workers there. So I wonder if this Mineral Council does also goes to those mines that I just mentioned, because there is a lot of complaint about from those mines that those workers are putting before us. They are saying that they are not being treated fairly, they are not being transported fairly. There is no measures in those mines. If they are there, they are not enough of the safety in as far as this PPE is concerned. And the transportation of those workers in those mines that I just mentioned, and many more others, the issue of transportation, there are no safety at all. The workers are complaining, they are calling us, they're telling us. So I want to know if this Mineral Council does also do a routine check in those mines to make sure. I know it will be difficult maybe to check all of them, but also just to make sure that they do check some of these mines.
Thank you, Babu Chenza.
And then to Chairperson.
I'm using my stopwatch.
Yeah, can I carry on, Chairperson?
I'm using my stopwatch. 5 minutes is over. I'm giving you just 1 15 seconds to say what you wanted to say.
Okay, thanks, Chairperson. Okay, we heard on the union side, we heard what the Solidarity said, but also there's nothing effective that we heard about them. The only thing that we heard here is only on the two unions, the AMCO and the NAM. Well, we agree with AMCO. A lot of things which they said, we agreed with them. We are agreeing with them. They are saying here, they found out that the mines are not ready. That is true. We are saying that as well, that the mines are not ready. And it's correct what they are saying here. And then also, we agree with them when they say the issue of the 50%. We raised it in this, one of my colleagues raised this issue in this committee when there was a department here. The issue of the 50%, the aim here for these employers is to retrench this other 50%. That one is a showcase. The AMCO also has found out about that issue. We agree with them. This issue of 50% is not good for our workers. And then lastly, 10%, the NAM. On the NAM, they seem to know everything. Last year they came here, they presented nicely, we even commended them. They seem to know everything, what is the problem, but we don't see them acting. At least we saw the AMCO, it even went to court to try to block the department to bring people to work. But we didn't see the NAM doing the same thing. Yet they are here, they are telling us one by one, they know every problem which is there, but I don't see them acting. I don't see them doing anything about it. Thank you very much, Chairperson.
Don't try to make my work very difficult, please. Honorable Malinga.
Thank you very much, Chairperson. Good morning to yourself, colleagues of the PC on mineral resources and energy, and our guests. Chairperson, let me welcome all the presentations made to the Portfolio Committee by all our guests. Chair, let me first applaud Mincosa that as they are doing their work, they are also considering communities where the miners are coming from in terms of assisting them with ambulances, paramedics, also distribution of food parcels and provision of water in schools. Chairperson, I just want to check if Mincosa, because in their presentation I saw that they said before lockdown was outlined, they had already have 10 points plan that was circulated to their members. I'm just worried, Chair, because their 10 points plan also informed us that they couldn't, some mines couldn't get PPEs. Because I heard Solidarity saying that PPEs were costing 19 million, and I'm worried, Chair, that how come a mine will complain that PPEs are expensive, whereas they are to provide their miners with PPEs. Yes, this time around it will be different, Chair, because you have to include masks and all other things that are needed by this to curb this COVID-19 pandemic. Chairperson Noom, they are saying, they are citing that the department is very weak, Chair. Is weak because it hasn't responded to their letters, or what is it that they are saying the department is weak on? And also, Chair, AMCU. AMCU in their slides on recommendations that miners or mines are to be deep cleansed and sanitized, also accommodation and transport. I thought MHSC was seized with this matter in terms of deploying inspectors in these mines to check if they meet the regulations as outlined by the department as to how the mines should operate. Also, no, Chair, they are saying correctional services is giving parole to people to do away with congestions in their correctional facilities. Why are they, as minors, supposed to go back to mines? I thought the regulations are clear, Chair. that there should be social distancing, there should be sanitizing, there should be screening and testing, all those things. The quarantine sites should be available in all these facilities. If I could just get that, Chair, even if whether the MHSC has checked that all these mining houses are adhering to the regulations that are put out or set out in the regulations, Chair. And Chairperson, lastly, what is the stance of Mincosa on the positive cases reported in the industry and their mitigation to limit more infections? Thank you very much, Chair.
Honorable Vulmarand.
Thanks, Chairperson. Let me also take this opportunity to welcome the presentations that have been made. I think from the Mining Council part, we get a balanced feel of where they are, what they have planned and executed with their members. And they're also giving us some few of the challenges, which include the question of salaries of members who worked for the first 21 days. But the major challenge was the applications for salaries in May. I know it's a question that might be dealt with by the Department of Labor, but I want to find out from the Mining Council, up to so far as we are in June, are we still going to have problems, or how far they are with the department in that regard? I know they have already said that they are going to have a challenge in towards month end of June. But as it stands, how far are they in that regard? The transport part, I think they are playing a very important role with the TEBA. Unfortunately, in our area of the Northwest, especially Rustenburg, I have had the opportunity to make a 10 at the offices of TEBA at some stage, and I could hear the correspondence and information that relates to people coming from outside of South Africa, Lesotho or Mozambique, and they were seized with it. However, when we come to what they have presented, and what you get from the union's part, there are a few discrepancies that they would have to sort out. Most of the union's presentation circled around communication between the members in the Mineral Council and the employees. Some don't know where they stand, firstly with their salaries, secondly with what is expected of them health-wise, and the communication with unions themselves. I think if the unions are taken on board in terms of the planning and the entire communication, I would want the Mineral Council also to talk to that part. The question of inclusive planning. The question of the spacing that has been, I think, articulated by Solidarity. And I say it's more especially from the women mine workers. We have found it in the areas where your Impala, for example, at some stage there was a protest around the actual spacing in these cages. How far have they gone in making sure that the mines, the members, adhere to this question? Is it still a challenge? Because, and I agree with them, because some of the mines would not make the cage to go up and down the whole day. And in that fashion, they want to save both on their electricity, on other matters. How far have the unions gone in as far as making sure that this happens in mitigating for the pandemic? I'm a bit covered by the 50% recall by the mines. My question is, has always been, how long would this take? Would it go beyond the 3 months and what happens in the meantime. I think it is still a little bit of a problem. The NUM raises a very important part, which I think the committee will have to look into. If it was not raised by NUM, maybe we would have let it pass and talk to the department on it. From the communities where mining is taking place, the communities are always having a problem with a lot of communication towards the department and no response at all. And it's now raised by the union as well. And it might be a problem in solving a lot of the other issues that are happening around the mining communities and the mines and the labor. I would want if the department would also look deeper into this question of non-response to issues raised by either the unions and or the communities in relation to what is happening around the mining areas. For now, I think the presentations are balanced in what we already know, what we have seen on television, what challenges we have seen. And I want to align myself with what Honorable Malem has said and said, after all the deliberations, what path do we care for? What are we going to get out of this engagement? Thanks, Chairperson.
Thank you, Babu Volmarans. I think I'm correct, Honorable Phillips.
Good morning, Chair. Good morning, everyone. Thank you so much for the presentations. I just have a few questions, mainly for Mincosa. I just want to check the tests that the mines are carrying out. Are they automatically included in the provincial stats that are given out? And if so, can we maybe ask that we get a breakdown of the tests that are carried out, which are carried out by the province or private, and then which are carried out by mines, if that would at all be possible? And my colleague Kevin Malem has covered the impediment to the restart up and the growth. And then I'd just like to also ask, has there been any cases of reinfection where someone has recovered and then has contracted the virus again? And my last, it's just actually a comment that it does seem that the DMRE has been mostly an absent.
Are you done, Honorable Phillips?
I am, thank you, Chair.
Oh, thank you. Mr. Kula, sir.
No, ndiyabulela Sihlalo. There was an issue raised by AMCU that there is no consultation. They are usually not giving or information. The information is not shared with them on the number of disinfection that happens around transport and accommodation places of mine workers. I want to understand from Mincosa that what is the difficulty to share this information with organized labor? Because in my own view, I don't think there should be any difficulties. My other concern, Chair, is around the return of mine workers. In the presentation by the council, it is said that more than 3,500 workers will be returning from Mozambique and almost 8,000 plus will be returning from Lesotho. This coupled with the fact that we're expecting a peak in infection rate around July, August, and already there are still challenges that they are failing to handle. How do they plan to handle this large influx of employees? There was also an issue raised around the vulnerability of female workers in cages due to overcrowding. What is the plan of the council to address these challenges? Because I think it's an issue that is not supposed to be tolerated, where female workers are placed at a vulnerable position in their workplaces. In terms of the presentations made by the unions, I've noted a concern around the presentation of AMCU, which spoke of shortages of PPEs. And I want to understand that what is it that the council is doing to address this particular concern? Because if already we have got shortages of PPEs and you are still expecting another influx of workers, it says we'll have problems. Another concern that is raised is that on the side of that workers who are coming from hotspot, who are coming back from hotspot areas, there are reports that they are not being tested. I want to understand from AMCU that how accurate are these reports and have they been verified? Another concern that was raised by AMCU is the neglect of contract workers when it comes to healthcare in the mining sector. And I want to understand that what are the plans that the council has to address this challenge of neglecting contract workers, because it might add on the increase of the infection rate in the mining sector. There was another concern raised by NUM that they are unable to observe, the inability to observe social distances in cages, which is in contravention of the regulations. I want to understand that what are the plans of the council to ensure that this problem is addressed? And I would always link it with the issue that I've always said of welcoming other workers from foreign countries. If you are unable to manage the issue of social distancing now, how do you then plan to manage it moving forward? Lastly, Chair, I want to say this at the risk of being out of order, Chairperson, that there must never be any ambiguity about what we say as a committee chairperson. While there are some amongst us who harbor ill-conceived misgivings about opening up the economy, this remains but a mere minority view. We support the gradual opening up of the economy, including the mining sector, as this committee, and there must never be an ambiguity about that. Thank you very much, Chairperson.
You knew that you were a little bit, but it's fine. You're still gonna take that matter up into the committee. Thank you, honorable members. Just few issues that I think are quite critical. I know it's gonna come back. I heard some members saying that we are now still asking questions. At this stage, there's no position with regards to the presentations that have been made by the presenters that have done presentations so far. So we still have to discuss or to agree on the presentation or disagree. I will give the answer, Honorable Melam, towards the end in summary, but most definitely the answer can't be from anyone in the committee except the committee itself on how to handle the process going forward. I just want to deal with a few issues to all the presenters that have made presentation, just to give them my observation. The first observation which worries me to all the presentations is that I don't get a sense I'm putting my own stopwatch also for myself. Why are you so quiet, all of you, about the role, mandate, and intervention that is supposed to be done by the tripartite body, which is the Mine Health and Safety Council, where all stakeholders, in my understanding, are supposed to sit? Is there a problem? Well, I would have thought that by now we'll get also the report as far as each stakeholder participating in the Mine Health and Safety Council. I don't think for me the responsibility of the Mine Health and Safety Council or its mandate, it should only be reduced into advising the minister. So I get worried when I don't get the response to say this is what it does. The second one, very quickly, is that I don't get the sense that there has been serious interventions on what role each stakeholder should play. For an example, how do you do monitoring of the implementation and compliance of this? If one could get a sense what role, as particularly, let me put it, what role does organized labor play in terms of monitoring compliance with all the requirements as set down, up to the level at a workplace level? The third point, which I am worried, what are the pros and cons, advantages and disadvantages of the 50% return to work? One might argue and say if there's 50% return to work and there's no capping of production level and profit margins, the risk is very high that if any employer may make 50% production margins in the same way it would have happened with 100%. So in terms of the future projections, I would love to understand how do we manage the 50% return to work if that is the case. But quickly, to look at the issue of the pre-existing illnesses or whatever it is in terms of the health conditions. Is this call of people coming back to work take into consideration pre-existing conditions of some of the people, or is just a question that everyone must come to work? It might be critical to get this thing. I want to repeat some of the things that members had raised, but my last area of concern was the question of a management of the expanded or extended testing and screening plan. At this stage, I think it's a little bit, it's like it is subject to who takes that decision. Some members talked about a pre-testing before the people come to work, but also and going back to say this is what has to be done. If there can be an understanding, is there an existing expanded or extended testing and screening plan? Please, you can answer Minerals Council because you are one. Please try and take your 15 minutes to answer to this. It actually means you will take us up to 25 past, and then I will try and give each of those who are going to respond 6 minutes to give responses, but it's subject to me being flexible.
Chairperson, thank you very much. And there's a lot of very important, very excellent questions by members, honourable members of the committee. And I think a couple of quick points, and I think maybe to start off basically with you as chairperson, honourable chairperson. I think we're certainly not quiet about the Mine Health and Safety Council. We did mention it in our presentation. We've had very active participation in the council with the union, with all the unions represented there. Lots of discussions on each of the different facets of how we manage these issues around standard operating procedures, et cetera, et cetera. And I know that Dr. Balfour, Nixon Sufi, for example, have been actively involved in many of the different discussions that have been taking place there. Quick thought, Chairperson, on the interventions and around the roles and responsibilities of the different people. Clearly the Mines Inspectorate, I mean, the Chief Inspector of Mines is on the is listening in on the session here today. Make no mistake, there's been a lot of activity in the Mines Inspectorate of going out and inspecting mines, and a number of unannounced inspections taking place by the Chief Inspector and the Minister. And they've been giving us feedback as the Minerals Council, saying, this operation's got a problem, that operation and this operation have been doing well, because I think it's important for us to know where the gaps are, et cetera. And I think, the unions also need to play that role in feeding back where things are not working as well as they possibly should. On the 50% return to work side, Honourable Chairperson, I think the challenge that we've got is that in large-scale surface operations, you can have 50% employment back and you can probably be producing at maybe 60, 70% production. In the deeper level of mining operations, if you've only got 50% employment, you have a large number of people who are in all the ancillary services on surface. So you may end up only having 30% of your production crews in place. And so even though you have 50% of your labor back, you only have 30% of your production actually taking place. And for many of the deep level operations, both platinum and gold, it is simply not viable for them to, they're doing it in a phased manner as the companies try and ramp back some sort of production. Because remember, many of these companies, particularly the deeper level operations, have literally have to operate for 3 weeks just to break even with their cost structures, given the large scale fixed cost structure in the gold mining sector, as an example, where fixed costs are 71% of the costs of those particular companies. But just the point is, getting companies back to sustainable running positions is key. And I can give you the categoric input right now. Bringing back some of the foreign migrant workers is a really important part of the equation of helping those companies, because people from different areas have different sets of skills that they bring into the mining mix, and getting companies back to more sustainable operating levels so that they can be viable. This is not about chasing profits. This is about companies being viable. Is a really important issue. I'm going to ask one of my colleagues to deal with the companies obviously calling people back. Remember that the national disaster regulations that indicated that people over 60, people with comorbidities, should be as much as possible either working from home or not brought back from an exposure point of view. But I'm wondering if Dr. Balfour and Nix Lesufi can answer that particular question. Nix, do you want to come in here? Tutula?
Thanks. I'll start with the foreign worker issue about why we are bringing them back when there's a crisis in the making. Now, the first point is when the lockdown was declared, all borders were closed. There were no access points for any foreign employees to come back. And as the Minerals Council, because of the skill set that some of the foreign workers are having, so we decided to start on a plan where we're going to have a phased return of the workforce in a very strict and coordinated manner. And that's why we engaged the Department of Health early on. Now, the principles of that engagement were that the workers were going to be screened in their home countries. And when they arrive in South Africa, they're going to be quarantined for 14 days. And that's the conditions that we are complying with. So as soon as the go-ahead is given for them to be able to come back, they will be quarantined for 14 days. But they're not going to be quarantined for 14 days at one go because of the bottlenecks at the border post. As I've mentioned, only 400 employees per day can go through the border post of Mozambique, and only 390 per day can go through the border posts of Lesotho. So all these returning employees will be staggered over 14 days period where they are quarantined for 14 days. All the medical and ancillary services are provided at the quarantine facilities, and then the companies only undertake onboarding activities after those workers have been quarantined for 14 days. So there is no chance that the workers will bring back any problems insofar as we are concerned. Thanks, Roger.
Okay, Nix, thanks for that. Honourable Chairperson, you asked about the testing side and the management of a testing plan, and we'll come back to the comorbidities in a moment. That's also been one of the questions from another one of the honourable members. But I think in terms of the management of an extended testing program, remember from the mining industry side, we have to work within the national protocols. There is the National Institute for Communicable Diseases protocol on screening and testing, and effectively you have to screen first. If a person presents with any symptoms or you suspect that they may be COVID-19 positive or exposed to someone, that they then need to be tested, quarantined, tracking and tracing around that person, and anyone who may have been in contact with them is then tracked and traced and obviously quarantined and tested at the same time. I guess the challenge, Honourable Chairperson, is that the country itself has a significant shortage of test kits. The National Health Laboratory Service has a daily testing capacity of about 30,000 people. It has been getting up to about 18 to 20,000 tests per day. There is a bit of a backlog in the system. The private sector laboratories have about a 20,000 testing capability per day. And so obviously from the mining industry side, when we've been doing the testing, most of our testing of employees has been done through the private laboratory side as opposed through to the National Health Laboratory side. So there is a limit on the amount of tests that can take place on any day or in any given period from a country perspective, just simply because of a shortage of the machines, the test kits, the laboratory services, etc. And I think, as we're all aware, there are some constraints. But what we are seeing is that from the mining industry side, we're doing the screening. We've screened 261,000 workers that have come back into the system. We've done over it's just under 13,000 tests of workers that we thought may be symptomatic or may have been exposed. We have been doing a bit of random testing of workers to try and make sure that we, particularly if they're coming back from hotspot areas, to also try and pick up cases. And again, we're trying to manage it in the systems within the national protocols as best we can. So just to highlight to you that we've certainly been doing testing at about 30% higher than the South African average test rate. And we're doing it because we're using the private labs at the same time. But there is a lot of cooperation that's going on between ourselves and the national lab services and the NICD. And so I think that's an area where we're trying to do as much as we can to work with local, provincial, and national government, National Department of Health in how we manage the particular program. Chairperson, if I may quickly just to go back to Honourable Milam, he asked, what are we doing as the Minerals Council? We obviously have a health policy committee in place, lots of sharing of information, a lot of understanding about the protocols, and we are trying to escalate where possible, where companies have the capability, testing not only in the labour force itself, but obviously also in terms of the in communities themselves. On the recovery of the sector, let me just say that the country's economy was in crisis before we went into COVID-19. There's a whole set of structural constraints. We were already in a degree of a fiscal crisis with our debt levels approaching 60% of GDP, very low levels of growth, investment sitting at 19% of GDP, which is very low compared to where it should be, and an economy that in the last 10 years has grown at an average of less than 1.5% per year, which is not even at South Africa's population growth. And in the mining sector side, I think we've seen, mining remains a key important economy, part of South Africa's economy, but again, a number of the different constraints. Electricity supply has been a massive issue. We probably saw 3% of South Africa's production in 2019 being lost because of load shedding. Now that 3% is a very big difference between, particularly for marginal companies, as to whether they remain viable or actually end up being loss-making. So if we look at some of the constraints that we're currently facing, electricity supply is no longer as big an issue. I think a lot of work is being done within Eskom to help solve a number of the challenges. We've got a lot of engagement going on with Eskom and with the DMRE on the energy side. And so that's become less of a constraint, although it is still a risk. There is still a risk of load shedding. In the pricing side, where we've seen prices go up enormously, and that has a big impact, particularly on the ferroalloy industry. And my colleagues from the trade unions did mention the concerns around particularly the Section 189s that we're seeing in the smelting industry, the chrome smelting industry, and that's because from an electricity pricing point of view, some of these companies just simply are no longer viable in terms of being able to produce ferrochrome in South Africa. So I think there's a number of different constraints, but in the immediate term, it's getting companies, particularly the deep level operations, back up to sustainable operating levels. And that's getting workers back in a phased manner, doing the proper screening and testing, making sure that we've got all the PPE in place, making sure that we are following all the necessary statutory and our own self-imposed protocols to how we're managing the situation. And then we've got a number of other constraints. Remember, even if we could produce 100% of our iron ore, we can't export 100% of what we produce because there also are constraints in Transnet side. They also have various challenges that they're dealing with in terms of their ramp up and phase up over time. But we're certainly hoping that by the end of this year, quite large portions of the sector should be back up to where they were almost pre-COVID. Would be a quick point there. If I can just say to Honourable Mthenjane, thank you. Yes, the Minerals Council does represent more than 95% of the value of mineral production in South Africa. We do represent the interests of our members. We operate on a mandate. We're not here to serve the interests of, you might define it as capitalists, etc. Our members are mining companies. We work with them to try and help them to be viable, to help grow their investments in South Africa, to help significantly grow their economic contribution. And I think the country does get a huge amount of the benefit of the activities. And I guess the challenge here is that, if we're not operating, people are not going to get paid. We're going to have a number of companies that will end up closing down. And so saving lives and saving livelihoods by putting in place all the right preventative controls is very much what we've been doing from the Minerals Council side. In terms of the number of increasing infections, if you were seeing the same level of testing in any other sector, in any of the provinces, you would see a similar prevalence rate. The fact that the mining sector is doing a lot more testing than many other sectors is the fact that we're seeing us managing, our systems are working. We are screening, we're doing the testing, and that's certainly helping us to understand the scale of the challenge. And this is not about putting lives ahead of profit. This is about putting livelihoods and lives together, because the real concern I think that South Africa faces going forward is that we've already lost 1 million jobs in the economy as a whole, not just mining. In the mining sector, we have had some job losses, but in the economy as a whole, more than 1 million jobs. And if we don't get the economy back and working, up to 3 million jobs could be lost, and that's going to add on to the already 10 million people who are unemployed in the economy. And that's going to have a huge impact from a poverty perspective and clearly from a hunger and other perspective. On the medical aid side, just a quick couple of comments there. The industry does have a comprehensive healthcare system in place, and we've done a lot of work in the last 20 years around managing our healthcare of our workforce. Last year, we tested 90% of our employees for TB. I'm very pleased to tell you that our TB prevalence rates are now lower than the national average. And that's been because of the significant effort we put into the whole process. So yes, some employees have medical aids, others don't. The ones that don't have medical aids are accommodated through the healthcare systems that the industry provides. And we are using that well-developed healthcare infrastructure to help manage the pandemic as best we can. Yes, there may be various complaints from various workers along the way. I think what's important here is it's important not to tar the industry with a whole brush, with saying that we're getting complaints here. It's not the entire industry that's got challenges. Most of the companies are complying with the requirements. They are being screened. They are being inspected by the Mines Inspectorate, and where there are gaps, where there are challenges, those can be brought to the attention of the DMRE, and the Inspectorate is doing their job in our view. The point that was made around mines not being ready, I think that's a generalization. We think that the industry is much better prepared than most other sectors in the economy. Yes, there are going to be gaps here or there, but in general, the industry has done a lot of work on making sure that we are properly prepared, not only on a PPE basis, but on putting in place all the systems, screening, testing, etc. Honourable Chairperson, we've got a couple of minutes left before you cut me off. So just to say, lots of work being done in the communities. On the PPE side, from our membership side, we've been surveying our members to see who are short of PPE. And certainly from the Minerals Council perspective, we're not aware of any of our members having shortages. If the unions want to bring it to our attention of which mines they think are not playing the game there. But certainly our understanding is clear. On the social distancing side and following the rules, what we've seen is a de-densification of all mining areas, including in lift cages. So they're not 100% of what you used to have before. We've now seen a reduction of 30% of capacity in lift cages. A lot of the companies have done a lot of work, but where you've de-densified in lift cages, one of the critical focal points there is obviously making sure that people have got the right PPE in place to make sure that they don't get infected, even if they are amongst people who may be infected within lift cages. So again, there's been a lot of work on how we manage that. Rising infection rates. Just to say, Honourable Malinga, we're going to see rising infection rates from a country as a whole. In mining, our systems are working, the testing systems are working, the screening systems are working, our quarantine systems, our tracking and tracing systems are working, and I think the industry is well prepared and we are implementing these standard operating procedures. Honourable Chairperson, to Honourable Wolmerans, there obviously are many different challenges that we are facing. We have had, and there are some challenges which Motsamai could possibly tackle, but I'm not sure we'll have time to do that. Maybe we can respond with a written input to you on the TERS side, and in particular, accessing funding and the constraints in the UIF TRS fund and how that's going to be a challenge. We've taken on board the communications issue, and we'll refer that back to our members. And then just a couple of quick last ones. Honourable Member Phillips, the tests that we do are obviously incorporated into the national healthcare data. So it is captured, and we have a daily portal that comes out on the Minerals Council website, which lists the number of infections in the sector. As of yesterday, we were sitting at 1,229 positive cases. We had tested 12,853. But we're not aware of any cases of reinfection. What's been more interesting to us has been the number of asymptomatic cases that we've picked up in the system. But again, that just demonstrates that our systems are working. We certainly haven't felt that the DMRE are absent. We think that the DMRE have been very active, certainly in the mines inspectorate and in our engagements with the minister, the DG and the senior team at the DMRE. And Honourable Chairperson, last quick one to Honourable Member Kule. Certainly what we're doing is, it's impossible to test every worker that comes back. We're certainly screening every worker, and then we're testing if necessary based on the NICD protocol. We've been, contract workers are treated exactly the same as any permanent employees, so we don't see the particular problem or gap there, but it's an area that we've been managing. And then my last point just to say is that turn of the foreign mine workers is being done in a phased manner. They are being screened, they are being transported by the companies, and we're managing this very carefully. So again, the systems are working, and we're doing our best, working with our partners in the unions and in government to manage this as best we can. But I certainly think mining has been one of the forefront sectors. Thanks, Chairperson.
Thank you, Mincosa. I know it's handful. It's handful. There is another point, but I will come later to it, and I'm sure honourable members might feel comfortable. Can I go to UASA? Any take on the questions that have been raised that might be relating to you? 6 minutes, please.
Thank you, Chair. That's the question from the Honourable Member Mailam, and I'm going to answer it in the following sense: that we sit currently in the mines. We sit with a legislation with regards to the MPRID on the one side, and then we've got the LRA that deals with our labour relations issues. Now, what basically happens is the situation where we come in with the retrenchments, the Section 189s, the LRA takes precedence over the Minerals and Petroleum Development Act. Therefore, even though we are trying and asking the companies not to proceed with Section 189s and the retrenchments, when we end up in the CCMA, the CCMA proceed in terms of the LRA, and that is particularly in terms of Section 210 of the LRA. Hence the fact that whenever some of those mines, and I must be quite honest and open, there was the situation with the Kangaroo coal, and the minister did request them to withdraw. They did withdraw the Section 189, and they're waiting for COVID as per the minister's request. However, if we look at a situation in terms of village minery, VMR, we're carrying on at this point in time with a Section 189, and that is based on the fact that the courts has ruled in favour of Section 210 to say that the LRA takes precedence over any other act, save for the Constitution. I hope that answers your question. Thank you very much.
Chair?
Yes,
Chairperson?
Yes.
I'm sorry, Chair. I'm not clear as to exactly what section of the MPRDA is being affected here, because it doesn't, as far as I can tell, and I've gone through it again now just quickly, deal with retrenchments in the MPRDA. So where is the conflict between Section 210 of the Labour Relations Act and what section of the MPRDA? Thank you.
Okay, you want to answer that one? I'll just try and be fair because you're within your 6 minutes.
Thank you, Chair. Thank you, Chair. I will do. It's in terms of Section 52 of the MPRID, and it refers to the fact that the companies need to report it to the Minerals Board and the Minister. Thank you. I hope that will suffice.
Okay, can we deal with that issue later on and see whether there is agreement? We agree with what UASA is saying when we deal with what we suggested has to be followed up. Solidarity, any take?
Thank you, Honourable Chair. Just 3 brief points. In the first instance, Honourable Wolmerans made that valid point, so our plea is then to the companies, but also wherever we can get the assistance is when it comes to social distancing in cages. Currently, in general, we are satisfied with compliance, but we don't want that to be an interim measure. We want it to be the new normal. And that's obviously something that over the next year will still be actively being driven to get that implemented. And then, Honourable Chairperson, you've also raised the issue regarding trade union involvement and compliance issues. So those code of practices also make responsible, first of all, the regulations in terms of the various regulations in terms of the emergency measures makes responsible for one individual being responsible per company where matters do get reported to. But those procedures also makes specific provision for COVID-19 teams. So the mines have all implemented COVID-19 task teams comprising of all the various trade unions having representation, and then also on those task teams serve obviously management, but mainly health and safety specialists. So the role of those task teams is to do the screening and monitoring outside and inside the workplace, and then to report all matters of non-compliance regarding social distancing and not wearing masks. So you can imagine it's a very onerous task because it means there are management representatives that needs to represent managers not complying. There are trade union representatives who have to report fellow workers who are not complying, and then that task team then deal with the disciplinary matters. And then often they go back to the camera surveillance where they, whenever there was a report, they monitor through the camera surveillance to confirm that non-compliance. So that's a fairly comprehensive process, but obviously it differs from mine to mine. But in general, that is the role we play. And then the last matter, Chair, that was also raised by you is the Mine Health and Safety Council. All the unions are actively involved. The industry through the Minerals Council are very involved. And since we are so involved, we did not deem it necessary to report on the matters happening there because even the department obviously plays the leading role there. And that Mine Health and Safety Council was responsible for the drafting of the guidelines. It was there debated, drafted and issued. So it is, the council do play an active role, but I think very important from a union perspective, that is the platform that we use where we hold industry, in other words, the mining houses through the Minerals Council who have a seat around the table. That's where we hold them responsible for non-implementation. Or any breaches in terms of the code of practice or the guidelines. So it is a forum that we believe, despite the fact that you have your challenges there, do play a fairly active role in terms of monitoring of compliance, but also where we also try to be proactive when there are new matters that needs to be discussed and debated there. The platform is there. So, Chair, thank you. That is my response to the various questions on behalf of Solidarity.
AMCU, 6 minutes. You can even take less than that. You're okay.
Thank you, Chair. I will respond to the issue of what we are doing in terms of compliance if there's non-compliance. Chair, we wrote several letters to the different employers as AMCU, and also we did inform the Department of Minerals and Energy, the DMR, about some of the mines that
I hope it's only me. I've lost you, Amco. I don't want you to continue only to find out you're talking to yourself. From my side, I can't hear.
Also on my side, Ayanda boss, I can't hear.
I think you lost signal.
Bagibele phezu kwentaba, Chair. They're wasting time.
Mateo?
Honourable Chairperson, we seem to have an issue there with Xolani's connection, but I can fill in the time. I've been asked just to answer the one point around, excuse me 1 second, there was a clarification to Honourable Member Kula's question to us about reports from hotspots and how reliable are they. The point we were making rather was we are concerned with the agility and the ability to react to when an outbreak occurs and any hotspots that emanate for the mines to react to that and us as a sector. We weren't saying we're receiving reports from hotspots not being tested. I can speak to some of the other questions Comrade Chair was busy dealing with. The non-compliant mines, he said, we've been writing to employers. We have been, every challenge we get, we have an extensive system from the ground of our shop stewards, our regional organizers, our chairpersons, all of that report all of these challenges to us, and we have an extensive system where we would draft up letters and contact the mine and the DMRE itself with these challenges. So that is currently being done. Then Mine Health and Safety question, Mine Health and Safety Council question was our answer is the same. We are actively engaging there, and we have actually been looking at different forms of possible testing for the industry, including randomized testing or even targeted randomized testing, because we have these constraints. But we do need more testing. We need an idea of the prevalence in the industry, especially since now we're going to have a whole lot of mine workers coming back. It is going to increase, but there's a real danger of that infection spreading to nearby communities and such and such. So we are engaging there quite actively, Comrade Chair. Then with monitoring compliance, what we do as AMCU was a lot of the same processes that we follow. All of the reports, we track them down right down to our branch level to see what is at issue. And we do then communicate them to the Minerals Council members directly, the mines, and we do engage them on that. But a lot of the challenges we face is getting communication back from them. So one of the honourable members asked, what's the problem with this information being provided to us? So we would like to just request from the Minerals Council directly as well, more open communication, and let's together try and deal with these challenges as they arise, so that we can both be informing your employees and our members more directly and more responsibly and accurately. Thank you, Chairperson.
Okay, NUM, your 6 minutes.
Thank you, Chairperson. I'll just utilize 3 minutes and hand over to my deputy for the other 3 minutes. In fact, I may use even less than that 3 minutes. Just responding to Mr. Maylam on what steps have we taken to deal with non-compliant mines. We do engage as we speak. We are in engagements with a company, one of the big companies in the gold sector, I'm talking as far as the pandemic is concerned. Apologies. For example, on the issue of people having to work from home and getting 70% or a fraction of their salaries, we are engaging on that because we say no. That person is working, but working from home. Whatever he cannot finish at home, instead of getting a fraction of a percentage, he must go to work and finish that at work. I think the engagements are positive in as far as that is concerned. On the issue of NUM not acting, whereas we see the wrong things happening, let me appreciate that criticism from the member who raised that matter. However, as NUM, we believe in engagement. Maybe we are over-engaging, but we appreciate that people can be able to criticize that we are too patient in some instances. But in as far as COVID-19 is concerned, we are not compromising on that. I'll hand over to the Deputy General Secretary.
Without waste of time, it is interesting. I want just to go where the GS concluded. It's interesting when a parliamentarian tells us that we must take the parliament to court. Very interesting. Because I ask myself, if we have to go to court in many instances, we must take the parliament to court. And I can ask the parliamentarians and say, why are you not doing your job so that we don't take you to court? Because you are complaining and saying, we are lenient, we are not taking you to court. I'm just asking that, why? Let us give the flaws that we also observe. You see, when you look at the regulations, as we speak today, we may be saying 50% and all this, but if you look at the regulation was talking more of 50% at level 4. Now, when you come to level 3, it's lukewarm, it's wishy-washy. You don't know whether it's 50%, companies can scale up towards 100%. And the mistake now is the regulation, because the regulation doesn't have clear guidelines as to what needs to be done. And who's doing the regulations? I'm sorry, from NUM, we're never involved in making those regulations. We take it that the regulations are done by the department, and the very same portfolio committee is the one that is responsible for the very same department. I can ask the question again, what have you done with the flaws that are in the regulations as the committee, as the portfolio committee, before you want us to take the department to court, if you are afraid yourselves as the portfolio committee? So who must then do your job? Because you are also afraid to go to the department and say, this regulation has got flaws. They are the ones that are causing problems. And we can, if you can engage us, we will show you where this regulation compromised us in many instances. At some stage, there was even misinterpretations where inspectors will even misinterpret. And we learned later that there was an engagement between the employer and the department. That's why there was misinterpretations of those regulations. For example, now, one of the critical issues is that the regulations doesn't force payment. Now, where there is problem of payment, and all these labor unions, they will tell you, all of us, we worked very hard to make a lot of employers to pay, because particularly in May, many of the employers were saying they are not going to pay, but we forced them to pay. Then where lies the flaws? The flaws is there because the regulations doesn't force the employers to pay. Now, it is the unions that were supposed to then fight those regulations and go to court and say, no, these regulations have got flaws. You are saying that workers must not go to work, but you are not saying to the employers, you must also pay. So we are raising those issues. The last issue that I want to raise is that, and we need to also raise the very same issue again to the very same portfolio committees, that if today you want to tell us that you don't know the problem between Section 52 and Section 189 of the Labor Relations Act, Section 52 from the MPRDA, I'm saying that there is a problem, and a very serious problem. And you must understand from the labor, our challenge is that those are the two sections of laws that, truly speaking, contradict each other. And mostly the employers run to the Section 189 because it is very simple and straightforward. What do they normally do? They will issue Section 189 and Section 52 simultaneously. They will run with Section 189 while the Section 52 is not done. And if you want to know that we're not doing anything, we can take you to the case law. When Anglo wanted to retrench 14,000 employees at a particular time, that you may know. If you know, if you don't know, it's not my problem. We went to court, but the court made a ruling that Section 189 process can run without impacting Section 52, because our concern was that companies don't conclude Section 52 of the MPRDA with the DMRE. They run to Section 189, and that is still a flaw. When we go to 2015, when we had a lot of Section 189s, we then, in the presidential intervention on job losses in the mines, if you go there and look at the recommendation, we made these recommendations that at certain time, the Section 52 and Section 189 must have synergy. One of the proposals was saying is that let Section 52 be completed before a company issues Section 189, because it is at Section 52 where we think that there is a lot of power where we can stop a lot of retrenchments. But as parliamentarians, we can ask yourself, as unions, we have made a lot of noises. We went to NetLeg, we went everywhere, where we say that even today you can feel all the unions are still saying that Section 52 of the MPRDA, where you are located, give us a problem, because Section 189 take effect first before Section 52 is implemented. And we can ask, very simple, as a portfolio committee, what have you done, or didn't you see as today that Section 52 is a loophole? Companies avoid it, they only run to Section 189. And by law, the court case law of South Africa are saying that there is nowhere where you can stop Section 189 because of Section 52. Those are two different laws. But we are saying that we will prefer a scenario where Section 52, either in terms of the law, either Section 52 says that you can apply Section 189 before you finish with Section 52, or Section 189 must then be saying that in terms of the mines, you must finish Section 52 before you do that. But we are saying that we have raised that noise as labor for many years, and yourselves are not assisting us, and you are the legislation yourselves. You are the ones that is running this legislation.
Thank you.
Chairperson, point of order.
Thank you, and wait, Honorable Milan, because we will run out of time. Let me.
Chairperson,
what's the point of order? Otherwise, we'll end up until the. Yes, what's the point of order?
Chairperson, my question that I asked was, what is the conflict between Section 189 and Section 52? Because as I see it, there is no conflict.
Okay.
They have to both be done. And to sit here and have a guest before the portfolio committee for not doing this unacceptable. It is not parliamentary for someone to come here and say, we don't know what we're doing, we haven't acted on it. It's absolutely unacceptable. I asked what was the conflict, and that is a perfectly reasonable request, because as I said, both need to be applied.
Can I say what I was going to say, and then we will take it from there, because I'm worried. Look, let's take the presentation that has been made, and say we think that we got the information that we needed. But I think it would be important, just from where the committee sits, to just draw a few areas. The Section 52 of the MPRDA states clearly that where prevailing economic condition cause the profit to revenue ratio of the relevant mine to be less than 6% in average for continuous period of 12 months, or, which is B, if any mining operation is to be scaled down or to cease with the possible effect that 10% or more of the workforce or more than 500 employees, whichever is the lesser, are likely to be retrenched in any 12-month period. Now, this is an operational matter, specifically relating to a specific workplace. And if there is a proposal for an amendment in law, it must be able to be tabled and be dealt with. I think it's important just to make this matter. And therefore, if there is a proposal, which I thought it was a general proposal to say, look, as far as we are concerned, from where we are as representatives of our constituencies, in this case is labor. That's how I understood initially the issue that was raised by UASA. We request the Committee of Parliament to also look at the possible conflict of the two, of which Section 189 of the LRA seemed to be prioritized at the expense of MPRDA Section 52. And in this case, and which I thought that's what UASA was saying, the LRA falls squarely under labor and employment. But can we look at it? So I want us to deal with the matter. Second, I thought the question that was being raised NUM was that looking at the issue of can we please make sure that in the background, whoever is in the background, switch off your mic, please. My understanding, well, it might have become very strong. The question was a statement that was saying, noting the fact that all these issues that are being raised and they are genuine, the concern was that there has been no decisive action. That's what the member was raising, had been seen. And the example, I don't think, if I were to be specific, Honorable Mtenjan was saying, why didn't you go to court? What I understood Honorable Mtenjan to be saying was that, for an example, we have seen that AMCU had taken the department to court when they weren't satisfied. They were not satisfied with how the regulations were or the process had been followed. Not necessarily saying it is wrong or it is for the Committee of Parliament to say go to court. I don't think that's what it was meant. But having said so, we will deal with other matters. But it must also be clear, no portfolio committee, especially mineral resources and energy, is part of neglect processes. Fourthly, the Committee of Parliament, its primary mandate is accountability. Maybe we should have given the background, but because of virtual meetings, they want us to have so much time to deal with. We have already invited the department. The department did make a presentation, and we then invited the Minerals Council because it had requested to do so, and we said, let us be fair and also invite the other sector. And if we don't invite the other sector, it would mean by the time they come here, probably it will be in August, and their effective input may not necessarily assist the committee. So I want you to relax. As a Committee of Parliament, I did say initially that this is how we deal with issues. Now, as I said, that I thought I was going to let me take the issues quite fruitfully. There are questions that honorable members have raised, and I want to convert these questions before the time is against us. I'm only left with 5 minutes. That the point, honorable member, that you raised, I want to suggest, because it won't take time, I want to suggest as follows. That probably when we bring in, as much as remember, we still have got the outstanding minutes that we said we must leave them until we get clarity. Clarity is simple. Where the department had come to make presentation on its strategy or approach in terms of the COVID-19 exercise, we suggest that, I want to suggest that when we bring back those minutes under matters arising, including these ones, before we adopt these minutes, let's have a discussion on what then we want to see as the way forward. In the meantime, the committee secretariat would look at possible areas that can be considered, amongst others, is what I've seen other committees have been doing. But remember, we still have got an outstanding matter, which is the matter of the oversight that we postpone. So we will look at what practically can happen. Amongst other things that I have in mind as an idea is not whether to prepare a report that will be tabled to Parliament so that that report can be owned as a report of Parliament with regards to COVID-19. Linked to that is the question that I think Honorable Mailam had raised with regard to the challenges or impending issues for the recovery of the sector, in particular post-COVID-19. What holds or what is it that is slowing down? One of those issues will be to consider developing or having a discussion on what will be a better foreseeable plan beyond COVID-19. It means when we look at the industry, the recovery of the industry post-COVID-19, I think that committee can deal with that. It must look at whether is there, with regards to the experiences of COVID-19, is there a possible conflict of the legislations. Lastly, on the issues that relate on issues of possible or potential job losses, we must look at general agreement. My view is that we can talk about the MPRDA and the Labour Relations Act. We must also understand that there is a principles agreement of these sectors to mitigate against job losses in the industry, and look at how far has that been implemented. I think for me, that remains the issue. So the point we're saying, Honorable Mailam, I'm suggesting that let that issue be a matter that we assist with as a committee on what do we suggest to be the way forward and compliance. And the sooner we do that, the better. So I thought I must explain those issues before we close. But the last point was we're left with 1 minute. I thought I was going to table. Can I table in the next meeting? But please, members, I also appeal to you. If we put it on or we send it to you, we suggest that we must discuss. There was an urgent request for a meeting. We will see in the meantime so that when it happens. But can I do what is required? Table the letter that we received from honorable members and be able to try and find time, whether it's for 30 minutes in the next meeting, Tuesday, for members of the committee to deliberate on the request made to the committee. Thank you very much, because I don't think we'll have time at this stage. This is what we suggest. We will bring the minutes. We'll try with the secretariat to bring the minutes of this meeting of today, and then we deliberate at that level, honorable members. Keep your notes for today, for the next meeting when we bring the minutes, including those ones we had a joint committee with the select committee from the NCOP. With those words, before we are switched off, thank you very much, honorable members. Thank you very much from UASA, Solidarity, AMCU, and NUM, as well as to the Minerals Council. Thank you for the department for joining us and listen attentively. We will come back and deal with the issues as and when we feel that there's still more that we need to get, including from our stakeholders. Thank you very much. The meeting stands adjourned up until next week, Tuesday.
Thank you, Chairperson.
Thank you, Chair. Have a safe day.
Thank you.
Thanks, Chair.
So, thanks, everybody. Hope you have a safe day.
Thank you. Thank you.
Thank you, Chair.
Thank you, Chair.
Vula phone. Call phone yakho. Yeke ukuvala phone la, vula phone honorable.
Thank you, Chair.
Hiya.